From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Good morning. Welcome to Medical Forum. I hope everybody is dried off. Hopefully everybody's safe. What a crazy weekend, Dr. Marr. I'm your host, Jeff Reed, for Medical Forum. My co-host, Chris Marr. Chris, I think we'd be remiss, and I do want to. Usually what we do is kind of talk a little bit, and sometimes we talk a little jovial about football and things, but I want to introduce our guest real quick, Erin Weeks, who represents Caris Hospice as a social worker and a volunteer coordinator, and Melissa Lewonuk. Yeah, great last name. And she heads up the marketing parts for Caris, and of course our good friend Mace DeBose is the physician there. And we're going to talk a lot about that. But I thought what we all might do is talk about our week that we have, not only personally and some of the things that we've gone through here, and then we'll talk about maybe what happened with our patients. So, you got a house left, Mom?
Yeah, we still do. I live out on 15 South, and got a lot of rain down there. But we were very blessed and fortunate that the living space of our house stayed above the water.
Did you ever lose any power?
An hour.
Did you?
1 hour. Never lost.
What did you do?
Power longer than an hour.
Were you totally lost?
No, we did all right. Did
you read a book?
We did.
Was this like the Waltons a little bit gathered on the fireplace?
I think we were playing cards at that point. So it was still during the day, and the water stayed on the entire time. I think for most places in the county, which is really impressive with our
From a personal note, I live over by Sumter High. No loss of power, no loss of water. Very, very fortunate. The only minor was a little loss of water pressure. Melissa, how about yourself?
We were good. We're out in the Wedgefield area. No power outages. Everything was good. Come Sunday, though, the need to feel like I needed to help. I did set out to go help over at one of the facilities in town. And much to our dismay and our trying, though, we were not able to get there, but we did everything we could. I had one of my CNAs with me. Yeah. But anyway, we gave forth every effort we could to be of help.
While we have the floor, let's shout out to Tasha Parker, because she was the CNA who flew Melissa into any and everywhere.
All right. And that's Erin Weeks. Erin, how about, aside from the accolades to your compadre there, how did you do?
And we did good. I live on the dry end of Lewis Road.
Okay, the dry.
Yeah, right across from the cows for, who looks. Down that little dirt road. We stayed dry. And now Club Lane did not fare so well. There's still a house that's just sitting underwater on the corner of Club and Lewis.
Yeah.
It's just very, very sad.
And here we are a week later. So, you know what? I do want to give a shout out to Darren McCormick, to Chief Rourke, to the David Whites of the world, our first responders. They've just been fantastic, and let's just hope everybody recoups. I was telling a friend the other day, I thought $81 billion, which was spent to recoup New Orleans, might pale here.
We're going to get there. And also, let's shout out to our representatives who got us on the FEMA disaster list.
Yeah.
Because that first revision, we weren't on there, and we needed to be. So.
Yeah, very good. Very good. So let's just hope everybody regroups. And you know what? We needed new roads on a positive note. I don't know if that's going to make it quicker. I know people that travel down Alice Drive is a little concerned, since it's only taken 4 years to get that one up. Maybe a light under some people. Dr. Marr.
Yeah, we definitely need some road construction. 15 be interesting when 15 will be fixed. Probably not, but anytime soon. But a lot of damage, but it seems that you can pretty much navigate the town fairly well, despite how much damage. It wasn't that long. I think we went in on Monday to assess the damage at all the offices. And
how's Colonial? I know you're up.
Tuesday? Did well. Tuesday, actually, Monday afternoon, we had a few patients calling in, and we got them in to be seen on Monday afternoon. And Tuesday, we were kind of business as usual. Right. Yeah.
And, in our listening area, of course, Clarendon, want to really wish them the best. I know they went through, I think at one time, Sheriff Garrett down there described it as 3 islands. So they're very split. Of course, a lot of water down in the Santee area. So all our prayers go out to everyone. I hope everyone almost a week later, right on the week, is up and running and such. So we consider ourselves very grateful to get through this. And I think what doesn't kill us will make us stronger. Agree?
Absolutely.
You know what? Today, though, our topic is Caris Hospice. And as we talked earlier, we have Erin Weeks, social worker and volunteer coordinator, and Melissa Lewonuk. I just like to hear her say that, so we make her work a little early on this Saturday morning. But Ms. Lewonuk is here. And Caris Hospice, Erin, why don't you take the lead here a little bit? Tell us about yourself. We always like to give a little bit of background because I think to our listening audience, once they get a feel of who you are and some of the things that have brought you into the hospice market, and I think you have a very interesting story. So why don't you start off with us, Erin, and tell us about yourself?
Okay. Sumter, born at Toomey Hospital and raised for the most part. My parents were, my mother was a nurse who worked with geriatric patients, and my father was a civil engineer and also a teacher. Jody and Charlene Osborne, for people in the community who remember them. My dad's forever getting emails from people he taught. Makes him very happy. So if he taught you, send him an email. He'd like to hear from you. But when I was a child, we became missionaries. We moved to La Ceiba, Honduras, where my mother, again, worked with geriatric populations in the community there. And my father taught school. Came back, lived in South Carolina for the bulk of it, went to Winthrop University. I did live in Georgia for a little while. I've been everywhere, but I keep getting back to Sumter, and I haven't escaped it again. It's been years.
Emphasis on the word escape. You think?
I'm here.
Well, we're glad to have you back. We're glad to have you back, and I'm sure your patients will echo that. Melissa, talk to us about yourself.
Well, I'm a Sumterite. Been here all my life. Went to the public schools here, then went to nursing school. I did about 21 years of nursing here. Some people know me from that, and then some people know me more from the children's shop that I opened back in '98, Little Darlings. That was across from the YMCA. Did that to about 2003, then actually ventured out and designed and manufactured my own line of children's clothing called Yo-Yo Clothing that many of your children may have worn. And was blessed to do that for a time and season. We did support the United States by doing all our manufacturing here in the States. We actually did it down in Manning, South Carolina. So I was blessed to have a partner, Phil Curlis, and at that time, and got out of that. A lot of the competition from overseas, started. Came back, was out of the medical field for a while, got back into it, had a nerve conduction study company for a couple of years, and then was out for a little bit, and then just had prayed about getting back in the medical field. And actually, Caris was just a godsend, and I've been there since about July. I certainly enjoy it.
Well, this is great. So we're going to call you two the Full Circle Girls, if that's all right with you. But as we come up on our first break, I want to thank the girls coming in here on a Saturday after a very trying week from Caris Hospice, and we'll continue to find out about Caris Hospice right after this.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
At Your Service Home Care provides in-home personal care, including light housekeeping, bathing and dressing assistance, medication reminders, meal preparation, companionship, transportation, and assorted other assistance to continue living safely and comfortably at home. At Your Service Home Care works with your local home health, hospice, Alzheimer's and VA programs, and other providers in the Sumter, Clarendon, Lee, and surrounding areas. Locally owned At Your Service Home Care is here to ensure you and your loved one continue to live your life with dignity and respect. At Your Service Home Care, 1250 Wilson Hall Road, Sumter, 803-607-9677. Please call, stop by the office, or visit www.ays-homecare.com and let them know how they may be of service to you and your loved one.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine, and they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
And we are back on the Saturday morning Medical Forum. I'm your host, Jeff Reed, with co-host Chris Marr. We're here every Saturday morning, even when the weather's bad, to talk about
or there's a Carolina game.
Or there's a Carolina game. Gosh. Can we take a second? Just LSU, best running back in the nation, and now we have to travel. Let's just leave it at that. I'm still getting over the Clemson Notre Dame game.
It was a great game.
Yeah, okay. You and Louder.
It was a great game. It was a good game. I like tight games, and that was a tight game.
You got a
tight game. Yeah, that was a tight game.
Do you like wet ones?
Well, I do. I had tickets to that game. My son decided he didn't want to go, so we stayed and watched on the couch, and I think that was a pretty good decision.
And, we always like to, because one of our best friends down at Bynum is Karen Schwartz, and she did such a great job last week on the show, and she picked Clemson in a close one.
She said Clemson and close. So I'm going to call her about some
Clemson and close
games, up and coming games.
If I see one more commercial that dual on these football games where you do the fantasy, I'm going to shoot myself. All right, we're off on a tangent. We are back with Caris. Want to thank you all for coming in. And when we left, we were talking, Dr. Marr, about hospice, which obviously you are very knowledgeable about. Discussions with hospice on the show times before, but I think today it's trying to talk about each individual aspect of it, and I think that's something that you wanted to kind of touch on, especially from a social work standpoint. With Erin.
Well, we've talked about the requirements for hospice, the type of patient that goes on hospice, who covers hospice, and we've talked about that extensively with several different companies in the Sumter area. But one of the things we have not talked about to this point is the kind of behind the scenes that goes on with hospice. Those workers who aren't often immediately recognized and who provide a significant amount of care and support to families. And what I'm really speaking of are social workers, chaplaincy services, and volunteers. And volunteers provide, in most hospice companies, a very significant amount of work. And so I thought we would talk about that just for a second. And why don't we talk about Caris's volunteer program to start with?
The first thing of everything you said that I want to just kind of educate the community on is hospice. While it is a medical service. It's more of an ideology. It's more of a philosophy. When you come to hospice, we're involving nurses, we're involving physicians, but we are not trying to prolong someone's life or to cure anything. So when you come into hospice, you're dealing with this idea that we're accepting of what's going on and we are going to keep patients comfortable. Part of keeping patients comfortable is making sure that they are cared for physically, spiritually, emotionally. When it comes to our volunteer program, Caris volunteers do a lot of things with patient visits. They do a lot of patient projects, making things for patients. Anybody who can crochet or knit or bake cakes, we want you to. Sometimes they administratively do some work out in the offices with helping to file paperwork or answer phones. What they bring to the table is really irreplaceable because they're coming out of the kindness of their own hearts. They're coming to do things because they just want to help. There are requirements for being a volunteer, and I am always ready to accept whoever wants to come. But you have to be able to pass a criminal background check. We will do a DMV check because if you are driving on Caris business, we need to make sure that your driving record's clear.
So that excludes Jeff Ruth.
It may.
Jeff Reed.
No, you were right on Jeff Ruth because you always got golf on your mind.
I was talking about Jeff Reed. Sorry, Jeff Ruth. I apologize.
2 more tickets and you might be out.
Which is fantastic because those volunteers can come from all backgrounds.
Exactly.
These are oftentimes maybe newly retired, younger, older patients, I should say, who may have retired from a career in anything,
right?
Business, sales,
right?
They don't have to come from a background of medicine. They don't ever have to have done nursing or social work.
No,
the training is provided there, and they really can have that benefit of.
Let me ask you
helping.
This. Yeah, maybe going on the other end of the spectrum. If I'm a 17-year-old, 18-year-old who's wanting to.
That's what I was going to tell you.
I'm
right
trying
now,
to bolster
my 2 biggest resources for volunteers are veterans. Caris is a level 4. We honor veterans approved hospice, which basically means we've gone through additional training with the VA to be able to receive VA referrals. So we have a veteran-to-veteran match program where when we get a patient who has been a veteran in their life, we try to match them with a veteran volunteer.
That's actually a really important point that you made, and that not all hospices carry that credential. And we've talked in the past about how hospices can be separated among what they do, what they offer. There's a absolute ton of hospices in just Sumter County itself.
Right.
And what distinguishes them from each other, and I think that's a really important point, though, that you're correct that the Veterans Administration does only work with a certain number of hospices. And what the benefit to that is, and correct me if I'm wrong or add to this, is that when veterans who are on hospice need to use the facilities at the VA, it's a very simple transition.
It's a streamlined process. Because they're VA, they're registered with the VA. It's just a matter of a couple of phone calls, and it's much more streamlined when you're dealing with a hospice that's been approved already. But to get back to your 17-year-olds, I do. I take
volunteers, 17-year-old volunteers,
volunteers.
Exactly.
I do take anybody who can pass that background check with the DMV.
And they can all pass the driving test?
If they have a license. Or even a permit. I've taken them on permits
they can
before.
Pass the background.
We did have Bynum on last week, and according to them, no one can.
No 17-year-old in Sumter County can pass the
driving
background test?
Yes.
I'm not going to call it out, but my poor kid is struggling. It's bad.
And I do want to, for anyone listening out there whose child or it's a 17-year-old listening, I've got a senior in high school right now, and you're always wanting to bolster, give yourself one more reason, whether you're looking at a scholarship or you're looking at possible
you're
money.
Making all my points.
Well, I want you now to solidify them. Okay. I'm speculating.
Let me put it into perspective for you. The 17-year-old requirement is only for people who want to visit with patients. If they're wanting to do projects or if they're wanting to work around in the office and get a kind of an idea of office management in a medical setting, we can take you even if you're 12, as long as you are mature enough to handle those phone calls and do what what we need you to do.
It's fantastic.
Now, as far as the 17 plus crowd, I moonlight as an adjunct professor at St. Leo, and under my license, not under Caris, because there's a whole bunch of mess with all of that with the paperwork. Under my social work license, I will take in interns. And so if you are a high schooler or a college student looking for an internship, give me a call.
Wow. Erin, I'll tell you what, because I think it's very important to the listeners, and of course we're going to get to the social work aspect, which is so vital, but we're here with Erin Weeks on this Saturday morning. Caris Healthcare, located on 105 East West Mark.
Or better described as next to Marble Slab.
Exactly. But they have a phone number, 774-8400, and we will continue to talk about the possibilities with internship, and then we'll really dive into the social work aspect, which is so vital. We'll be right back.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports, WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
I was Daddy's girl. He was my guide, confidant, and friend. We cooked out, fished, and talked about everything. He has trouble remembering those times now. I'm the parent and caretaker to my dad. He does remember losing his dignity each time he needs my help with simple daily care. Calling At Your Service Home Care was the best thing I've ever done for my dad. His personal attendant provides assistance with bathing and dressing, a compassionate presence for his safety, and even travels with our family. Having At Your Service Home Care working with me now gives my dad his dignity, and I can enjoy just being his daughter again. The wonderful people with At Your Service Home Care have the gift of caring for your loved one. If you have become the caretaker to a parent like me, contact At Your Service Home Care, 803-607-9677. Located at 1250 Wilson Hall Road in Sumter, or visit the website www.ays-homecare.com.
This is Medical Forum, presented by At Your Service Home Care.
And welcome back to Medical Forum on this non-rainy Saturday morning. Unlike last Saturday morning, we wish and hope everyone for a speedy recovery. And when we left, we're here with Erin Weeks from Caris. She wears a couple hats there. Volunteer coordinator, which when we were leaving last, we were discussing that, and we were talking about the volunteer program, and we were talking about, I think Dr. Marr, you talked about, all that encompasses and how valuable this volunteer program is. And Erin, what we left with you was that this is something that there might even be some internship and such for our young folk.
Yes.
So
now it's not paid. I also get asked that. Do you offer paid internship? No, we don't. And in Caris as a company, like I had said before, there's a lot of insurance paperwork and things like that that agencies have to do to be an internship as a company. So Caris as a company does not offer that. But in South Carolina, I'm a licensed master social worker, and I can certainly sign off on a lot of things for people. And I have had several St. Leo, some USC, and some of the kids from the IB program at Sumter High School have done some internships with me. I've got a Kaplan student right now as well. So for the schools that will work with me, I'm glad to work with them.
Great. St. Leo's and such. But the best way for someone listening out there that might want to be a volunteer and might want to add this to the resume, might be a difference maker between scholarship or being accepted into a school, 774-8400. Ask for you there at the Caris office or stop by maybe.
Come on by.
Someone will be there.
Now,
right?
One thing about Caris is they openly encourage us to not be in the office. They want us out in the field. So call before you come if you want me. Otherwise, our office manager, Tammy Martin, shout out, is amazing. She knows where all of my documents are, all of my apps. If you just, have 10 minutes here and you want to pop in, go ahead. Tell her you're interested in being a volunteer, and she'll get you the information that you need.
What kind of ice cream, if they're going to come to this much trouble to come to the office at Marble Slab, what kind of ice cream should they bring for Tammy?
For Tammy, it
is...
For
Tammy, because you will not
and
be there,
and
we'll talk about social work
I get her
here
ice
in a
cream
second.
often because she is awesome.
Mm-hmm.
She would like the birthday cake flavor with sprinkles mixed in.
Okay.
And she's really, that's all, because she's
So if you guys want scholarships to college in a volunteer internship,
that's right.
You young kids out there, stop by Marble Slab, go see Tammy. She will put you with Erin. Erin will not be in the office because now we're going to talk about social work.
Being a social worker.
And we've all heard the term, and if we've ever been in the hospital, that we know that's the person who discharges us. Dr. Marr, you and I in our little professions deal with social workers on a daily basis. Erin talked to us about what is a social worker and how does a social worker inside of Caris and hospice maybe even differ from the hospital social workers?
Okay. Well, first and foremost, you say social worker and somebody starts, grabbing a hold of their children or their elderly because they're afraid we're coming to take them. That's not what we're here for. We're not anybody. Don't be afraid of the social worker. Hospital social workers, typically spend their day with discharge planning and things like that. Social work as a profession, because it's broad. You've got the people who work with abused children. You've got the hospital social workers. The VA has theirs. People always want to know, what is the connecting factor? What does it mean to be a social worker? Because you kind of do everything, and you really kind of do everything. What it is, a social work is a skill set, and it's a skill set that is based on what we call the systems theory. We understand that every person lives within a system. Nobody lives in a bubble. No man in his island is an island. So when something in your system is breaking with a car engine, the whole thing will eventually break down or it's going to malfunction. So what social workers are is we are experts of the system. And we look at the system within your family structure or at your facility if you don't have an involved family, whatever is your support. And we find what needs to be supported more, and we support that. And that way we keep, and these are very general terms, but what it looks like is, let's say we have a patient that lives in a rural area and that, has one caregiver and they can't really afford to pay other caregivers. How do we get this person help? So, because you don't understand that when you're caring for a loved one that is totally dependent on you for everything, going to the grocery store is a tremendous challenge. Right. So the social worker comes in and says, okay, what can we do to help this family be as independent as possible, but to not be alone in this? And we assess what's available through the community, what's available through their church, what's available through our company, what's available, in the area, and then we help fill those needs. So that is one end of social work.
We find patients all the time that just do not understand how many resources can be available to them based off their backgrounds.
Mm-hmm. Yeah, and there's
what they qualify for instance.
Right. Now, I have also found that a lot of people don't want to disclose. They don't want to disclose their income, and most of the services that you can get, you have to disclose these things in order to get them. So, again, I have families that are resistant to disclosing that, but it doesn't mean I write them off and say, well, if you're not going to play ball, I can't help you. It means that we just look in other avenues. Okay, do I have a volunteer who can go sit with this person? Do I have, what's available? Who in your family? Who in your church? What can we do? That's the community aspect of what the social worker does. It also goes down to the individual level. One of the things that the social worker is tasked with is determining someone's cognitive abilities, determining whether or not they can speak for themselves. Because in our county or in our catchment area, a lot of our patients are dementia patients. And so there comes a point in dementia where you can't make decisions for yourself anymore.
We're with Erin Weeks with Caris Hospice, and she's the social coordinator. Erin, let me ask, are you the first point of contact? If I have a loved one that we've been caring for, or a father, and we talk about this, where we're starting to wonder if hospice is the option for us. The physician, is it generally you? Is it generally, does somebody knock on your door and say, I saw your sign?
That has happened.
Okay. and we're concerned.
For the most part, I'm not. For the most part, it's our doctors and our nurses at facilities who begin to notice when a patient is appropriate. Having said that, through various community functions and getting out education to people out in the community, I have brought us several patients that met me first. I picked up a patient at the chili cook-off a year ago.
Okay.
I picked up a patient at a health fair. And what happens in these events is we're out and we're giving information and we're just talking to people. You have loved ones who have somebody at home with them, and they start to think, Mom is having trouble with this. I am having to take more time off of work to care for her. And then they'll show up and they'll start asking me questions. And from there, Caris has what they call a go-see process. We don't always immediately send a nurse out to put a cuff on you. And you'll find that a lot of hospices do. We have a go-see process. And the purpose of that is to explain to you what hospice actually is. Because it has happened when I've met other hospice patients before that they don't even realize we're talking terminal diagnosis.
And this is what you would do as a social worker. You might be going back to it, the first line of of contact in that situation. We're coming up on our third break. Caris, compassion, accountability, respect, integrity, and service. That spells Caris. And we'll talk about that when we come back. Also, I want to give a quick shout out to our friend Jeff Fall and the Toomey Foundation. Had a cancellation, postponement, we won't call it a cancellation, of the golf tournament. Great golf tournament that Toomey does and supports so many nonprofits. And it looks like November 6th, and I believe that's a Friday. But call the foundation, I believe it's 774-9000, and get all the details. But just postpone, not cancel. And we'll be right back.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Brooke Luce, admission instructor with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And we're back this Saturday morning with Medical Forum. As you know, Medicare recipients are inundated today with choices about durable medical equipment. I think if you watched the football game last weekend, several ads for any type of DME equipment, back braces, elbow braces, knee braces. And one of the things we've talked about is the importance of staying local for multiple reasons. Number one, a lot of these companies will call you without being solicited and ask for information on the phone, which is always concerning for fraud. And when the equipment is purchased or billed through your Medicare, is there an ability to return the equipment? Can it be fitted correctly? So again, really important to stay local equipment. The best place to stay local is Reliable Medical Equipment in Sumter, South Carolina. Go over and see Richard. Richard is trained to fit braces, orthotics, knee braces, and various equipment. And Reliable will work with your physician to get you the equipment that you need, make sure it fits right, make sure you're satisfied with the equipment, and they'll take good care of you. The number over there is 934-9212, or you can visit them at 246 Broad Street, Sumter, South Carolina.
It's funny, we have people here from Caris. I think a couple of them out of reflex still come over to Reliable Medical because that's where their old building was. So if any of you have used Caris in the past, be more than welcome to come in and we'll vector you to see Caris on Westmark. But we all shared a building at one time. I know it goes back a couple of years, but right across from Firestone. So we thank Reliable. Also want to let everyone know that if you're catching part of the show or you want to catch it all again on Sunday from 2 to 3, we re-air on this same fine station. And when we left, Erin, we've covered a lot of subjects. We talked about the volunteer coordinator program that you had up in the social worker aspect. When people think of hospice, it's a team. And I'd like for you to, we've talked about hospice and qualifications. And again, to reiterate, Medicare is a great cover of this. So it is something that's covered when your conditions allow. But let's talk about your team from top to bottom, from your medical director on down. So if you can speak to what really makes up a hospice.
Okay. Well, like you said, Medicare pretty much dictates how the bare bones of how a hospice must run. So you're going to get a certain similarity between all hospices who emerge, especially in our state where it's not regulated as to how many there can be. So we have a lot of hospices out there. And you have to consider which hospices in your community are able to meet your needs, and that's kind of part of the team aspect. Our medical director, this would be the doctor who oversees all of the cases, who prescribes for the patients. If the patients must be seen, he would usually go to where they are if they can't be brought to him. Ours is Dr. Mays Dubose, who seems to be the medical director of everywhere for Clarendon and Sumter County.
Very good friend of the show.
Yes. And just an amazing physician. Just when it comes to geriatrics, that is his specialty, and we haven't asked him a question yet that he doesn't have an answer for. He's just awesome. We see him every 2 weeks because at Caris we have what we call IDT, which is interdisciplinary team, where somebody from every part of the team is present at this meeting, and we discuss each patient. So Dr. DuBose is in-house every 2 weeks to discuss these patients that we're caring for. So next to him would be our nurse practitioner, and that's Kathy Malloy. She is affiliated through Central Carolina, part of their program coordination and teaching the nursing students over there. The nurse practitioner does what we call face-to-face visits, which is kind of misleading because everybody does face-to-face visits. But the purpose for her is she goes out and she works on recertifications. When a patient has been on hospice for a certain number of months, they have to be recertified so that Medicare can know they're still appropriate. And so Kathy will do our face-to-face visits, and she does those for Sumter and Columbia. We've got Caris in 8 counties across the state. So Kathy covers Columbia's catchment and Sumter's. Inside the office, who you'll find in the office, we have an administrator, and we actually have new meat in the building. Her name is Brandy Thompson, and she's awesome. She comes to us from the Kershaw County area, a lot of experience. Very nice lady. So the administrator's job is to crunch numbers to make sure that we are operating within our budgets, to secure contracts and deals and things like that, but also to be the team leader in-house. After her, we have a patient care manager position. That's a nurse, and she schedules all of the nurses, and she is also the one who orders medications and things like that. Our other nurses can do that too. They have direct line to the doctor, but the patient care manager is like the nursing supervisor.
Okay.
Then we have our RNs who are, and Caris is one of the hospices, not LPNs anymore. We do have an LPN, and we adore her. Her name is Sandy Miles. But our RN is Tina Hudson, and she's the little engine that could. She never, ever stops, and she's about as tall as a doorknob. But she is awesome. Our RNs are there for just taking measurements, tracking, decline, explaining to family. One of the big questions everybody has is how much time? We can never answer that because we can answer stages. We know what the stages of a terminal illness look like, but we never know how long each one is going to last. But the nurses are there to make sure that families are informed every time something changes. Okay. And so that's LPNs and RNs, and then our chaplain.
Okay.
I got a little story to go with this. This is cute. Nathan Falco is our chaplain. He actually lives in Florence as a compromise because he covers Sumter and Myrtle Beach. So he travels a lot. And Nathan is just so competent at what he does that this is how competent he is. We have a patient who is an atheist, and he serves her. And and people always say, huh? But in hospice, we define a spiritual need as anything that brings meaning to your life.
Very good.
And so spirituality is always, you can cover that even through atheism, because someone who does not have a belief still has meaning, still has value, things that they enjoy and that bring them depth. And so for this lady, it's the Steelers. Not even kidding. So this is our chaplain. He meets her there, and he provides excellent service to her. And like I'm saying, that's part of the social work ideation of hospice is we will go where you are.
Very
we
nice.
go to the patient where the patient is. And then our unsung heroes, the ones who do the backbreaking day-to-day labor with a smile, are our CNAs. And these ladies it's a mission for them. It's a calling. They have all been with us for multiple years. One of them as long, I think, is 8 or 9 years, as Caris has been other incarnations. We've got them, and they're not going anywhere. And the families adore them. They come, they help to tend to hygiene needs of the patient, light housekeeping. Sometimes you have a patient who is able to take care of their own hygiene. So what's the CNA going to do? Well, we'll vacuum the floor for you. You want some coffee?
Erin, you are absolutely, and Chris and I can tell you from a business with CNAs are the backbone. We are coming up on a short break here, and we'll be right back with Erin and Melissa, and we'll continue to talk about Caris, and we have one more segment, so please stay with us.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
This is Brooke Luce, admission instructor with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Reliable medical equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street, voted best prosthetic and orthotic business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
We're back with Erin Wheat and Melissa. Melissa, I always ask you to finish. Lewonuk. I do that all the time. Lewonuk. From Caris. Thank you all for coming in and sharing not only about Caris, but the whole inner structure of what we do with hospice. And, as Chris mentioned, we like to stay local. You guys have a nice location there, as we talked about, by Marble Slab on Westmark. One of our great sponsors is Tri-County Hospice and Home Health. Also have MediHome. Their durable medical equipment is second to none in town on Baltman. Their hospice and home health. we've had them on the show, and they speak the same language you guys do with hospice. Just caring people, great physicians. We feel with 19 hospices in this town, and we try to encourage people, and this is what we're going to talk about in the last segment. Do your research, number one. Make sure these people are local, like yourselves. Make sure that they are, as anyone who's listening to the show can hear in your voice, Erin, committed. These are not something that you just decide you want to be a hospice. You are born to be that. And when you mention CNAs, Chris and I know very closely to CNAs. They are in their commitment. And if you knew what they were getting paid to do it, then you would think even more so. And as we came through this disaster this week, and we're still recouping, and we'll continue to have that, and there's still roads and bridges that we can't come over. Tell us about life as a hospice. Give us a few stories as we've got areas that we can't get to, but we have patients who need us, and they are going through as serious time as possible. So share with us some of the stories of Friday a week ago in the life of a hospice.
Well, and the way we handle these situations, when we have warning, for major weather events, we have warning. We were informed by our compliance officer, who is based in Columbia, that this was coming up, and an email went out to all the social workers in Caris for the whole state on Thursday afternoon that they wanted us to call and actually speak with someone in the home or the facility on behalf of every patient we have to find out what are your plans if you have to evacuate, where will you be, so that when the CNAs can dispatch, they can find you. If you don't have somewhere to be, let me tell you where you can go. So as the social worker, and that's the social worker hat, I'm on the phone in all the counties where we have patients, calling emergency management to find out what your designated evacuation areas are going to be. So before I even call a patient, I've got to have a list of where I'm going to tell you to go if you don't know where to go. So I started my phone calls for that on Friday, and that was basically my whole business day, getting in touch with facilities, patients, families, taking stock, asking them to go look at their supplies, because one thing that hospice does for families is we supply a lot of things, and that relieves a financial burden, but it also relieves just a logistics burden. If I said that I have the patients who are rural and they can't get out, well, trying to go get supplies is kind of difficult. So we bring a lot of those supplies at no cost. So I got everyone to tell me what they needed. And then when I took all of that information, gave it to the CNAs who were assigned to those patients. So when they made it out Friday for their visits, they brought extra supplies because we knew it would be a while before we could get back. Well, actually, we didn't. Everybody I called doubted that we were going to get this rain. I was like, look, I know you think it's kind of crazy, but we would rather be prepared than not. So this is what we're doing. So the rains came all through the weekend. We're all, the staff is all in communication with one another. Our little hero, like I said, tall as a doorknob, she was constantly on the phone with families, finding out who needed what. We had one patient in particular that looked like he was going to transition, and we needed to keep his family informed even though they couldn't get to him. And so our phones were constantly dinging with, this patient, that patient, this patient, this is what we need, this is who I've talked to, keeping all of that coordinated. Monday morning, no one could get to the office except for me because my husband is amazing and routed me. It took us about an hour to get there, 4 miles from one place to another. So we could do our stand-up call. I told you the stand-up call every morning at 8:15. We do a group call, and every afternoon at 4:30 we do it again to check in with each other to make sure that we all know what's going on with all of our patients. So I managed to navigate to the office Monday for stand-up and stand-down calls. And by Tuesday, everybody was back in the office through sundry routes, however they got there. But that's what I was doing yesterday. Was I had 2 computer stations set up, 3 phone lines. I was on the phone with emergency management, sheriff's departments, trying to get routes for CNAs to get to patients. And so I'm in contact with them on the road. I'm pulled off here, I'm blocked here, I can't go anywhere from there. And so I was kind of like central command. So turn around and go back the other way.
It's very interesting because everyone, for the most part, is thinking, how do I take care of myself? How do I get to school? How do I go to the girls? You have a census 15 to 20 people. So when you're talking about helping one, you're helping 20. And they're spread, across your area here. For the people listening in our area, the radio station covers Clarendon, Lee, bits of Florence, almost to Columbia and Sumter, and that's pretty much your area. Mm-hmm. So it's not like this is 15 people all going down Broad Street.
They're scattered.
Yeah.
They're everywhere.
Now, let me ask you on that note. I've had a card of yours for a while now, and it is 20 promises that Caris, and each person carries this card.
Yes.
And we don't have time to get into all 20 of them. But just suffice to say that they are holding your staff accountable. Yeah. It's encouraging a lot of them, and it's things you mentioned, and for people listening, stand up, stand down. That actually, everyone on your staff at 15 is on a conference call every day to discuss anything that was promised, whether it was, I was going to bring him a candy bar, or, oh my gosh, it was flowers for someone, and it's a reminder for everyone, and I think it's a great uplifting and a motivational thing that you do. But as we have about a minute and a half left, I'm looking at your list. Pick out, Erin, let's say 3.
3, okay. This is part of what we call the better way. Every employee and every volunteer has to agree to the better way, or they can't work with us. So my favorites are care for you the way you want, because what you perceive as being taken care of may be different than what I perceive.
Number 4.
Yep, number 4.
This is your top 10 list.
This
Cut
is
to 3.
My top 3 list.
All right, here we go.
Care for you the way you want, because whatever you need, I want to give it to you. Not because I want to give it to you, but because you need it, and because we're going to do it your way. I like the Honor Your 3 Most Important Things. That's a program specific to Caris. When we first meet a family, we ask things we need to do to give you excellent care.
Number 7.
And that can be from, remember that I actually like to go by Eddie instead of Howard, or I need a candy bar every day, or I need a this. Whatever those things are, a lot of our dementia patients, the ladies, like baby dolls. So we have
Give us one more.
One more, okay, is to keep you informed.
Awesome. Caris Healthcare spread out through South Carolina, Tennessee, Missouri, even a location there, but in the Sumter location, 774-8400-105 East Westmark. Pick you up some ice cream. Go see what's the girl? Tammy. Bring her. If you've listened to the show, you know what to bring her accordingly. It's out there if you kids are listening in. Come volunteer if you're an elder person just wanting to help. And I appreciate you all coming in, and have a great weekend.
Thank you.